Hello everyone, today we'll be studying about the Kennedy's classification. The Dr. Edward Kennedy of the New York proposed this classification in the year 1923. This is the most popular classification. So let's begin. In the class 1, there is bilateral edentulous area located posterior to the remaining natural teeth. That is, there are two edentulous spaces located in the posterior region without any teeth posterior to it. So this is the example of the class 1. That is, there is bilateral edentulous area located posterior to the remaining natural teeth. Okay. Now class 2, there is unilateral edentulous area located posterior to the remaining natural teeth. That is, there is a single edentulous space located in the posterior region without any teeth posterior to it. So this is the example showing the unilateral edentulous area that is located posterior to the remaining natural tooth. Now class 3. Class 3 is a unilateral edentulous area with the natural teeth that is anterior and posterior to it. That is, this indicates a single edentulous area which does not cross the midline of the arch with the teeth present on both sides, anterior and posterior to it. So, example here, edentulous area presenting the remaining natural teeth anterior and posterior to it, and it also shows that this is the unilateral edentulous area. So, unilateral and the remaining tooth anterior and posterior to it. So now next is class 4. Here, single bilateral edentulous area located anterior to the remaining natural teeth. This is single edentulous area which crosses the midline of the arc with the remaining teeth present only posterior to it. So as it shows, single, this is single but bilateral edentulous area which is crossing the midline. So it is class 4. Now the next is the Applegate's modification in the year 1960. The Applegate modified the above Kennedy's classification based on the condition of the abutment to include two more additional groups. That is class 5 and class 6. In the class 5, the edentulous area bounded anteriorly and posteriorly by the natural teeth, but in which the anterior abutment, example the lateral incisors, is not suitable for support. So, in the simple way, it is basically a class 3 situation where the anterior abutment cannot be used for any support. Hence, it cannot be treated like a conventional class 3 edentulous space. So, let's see the example here. It is basically like the class 3, but the anterior abutment is not suitable for the support. Now, we have the class 6 modification, that is the edentulous area in which the teeth adjacent to the space are capable of the total support of the required prosthesis. This denture hardly requires any tissue support. Most of the removable partial dentures are tooth tissue supported. Hence, this condition is classified in the separate. So now the Applegate's rule. The rule number 1 states that the classification should follow rather than precede the extraction that might alter the original classification. Rule number 2. If the third molar is missing and not to be replaced, it is not considered in the classification. Rule number 3. If the third molar is present and is to be used as abutment, it is considered in the classification. Rule number 4. If the second molar is missing and is not to be replaced, it is not considered in the classification. Similar to the rule number 2, right? But here third molar, here we are talking about the second molar. Now, rule number 5. The most posterior edentulous area or the areas where always determines the classification. That is, the most posterior edentulous area or areas always determine the classification. Now, rule number 6. The edentulous area other than those which determine the classification are referred to the modification spaces and are designated by the number. Rule number 7. The extent of the modification is not considered. Only the number of the additional edentulous area is considered. That is, the number of the teeth missing in the modification spaces is not considered. Only the number of the additional edentulous spaces are considered. Rule number 8. There can be no modification areas in the class 4 because any additional edentulous loss space will definitely be posterior to it and which will determine the classification according to rule number 5.